Hello, everyone, and welcome to another episode of Beyond the Superficial. We are chiropractors and functional medicine practitioners at Synapse Center for Health and Healing, located in Eagan, Minnesota. Information shared in this podcast is not intended to diagnose or treat any medical conditions. Please consult with a primary care provider before engaging in any new activity or protocol. With that in mind, let's dive into this episode.
To Beyond the Superficial on our Menopause podcast series. Today we're talking about debunking the myths in menopause. I know we have a lot of patients and listeners that are in this age group that are dealing with perimenopause and even menopause. So we have a list of questions that we're going to talk about together as a group and try to debunk some of the things that people are afraid of happening. Because what we want to do is normalize the experience that can be loneliness, confusion, and the roller coaster of not just hormones, but the emotions and not knowing what to do. And should I treat my hormones? Should I just go through this naturally? There's so many issues that we're thinking about at this time in our life because we just don't feel great. And I told my husband, I just feel like women should be shouting from the mountaintops about perimenopause because it's really rough. And so we want to put some information out there just to help people. So the first myth, and I'll ask this to you guys, is menopause only means hot flashes and your period stopping. Is there anything else?
Yeah, I feel like if a lot of women say like, oh, I haven't gone through menopause because I didn't get any hot flashes. And that's not necessarily, you don't even need to have hot flashes to go through menopause. The technical definition of menopause is a year after your last menstrual cycle. So that's officially the start of menopause. But there are a plethora of other symptoms that women experience. So it really impacts your mood, your sleepiness, brain function, bone health, cardiovascular health, inflammation. It kind of impacts almost every area of your life, and we're going to kind of break that down a little bit more. How do you feel like it impacts their mental state?
Yeah, so for women, it's definitely not just hot flashes. I'll see a lot of women, specifically in this age group, talking about their hormones and talking about how those hormones can impact their mental state. And sometimes there's not even the correlation of it. It's actually because my hormones are shifting. If you think about your hormones and your amygdala in your brain, that's directly connected to how your neurochemicals respond. So if there's cortisol, cortisol is a hormone. And so as our hormones are changing, our ability to regulate, our capacity is changing. For some women, it will look like trauma resurgence. So things that maybe we didn't, we had capacity in the past and now our hormones shifted, all of a sudden that capacity is kind of removed, and things that you were able to tolerate and had the capacity and resilience for, all of a sudden there's none of that. Right? And so realizing that can be some of the biggest symptoms for women, and the biggest hurdles is not even the physiological things, but the psychological effects of what happens when your hormones shift. Because even with women, what I'll often say is it's not like it's just a steady decline and your hormones are gone. It really feels like a roller coaster where they're up and they're down and they crash and they just kind of go berserk for a little bit. And how hard that is on the body, how hard that is on the mind, how hard that is on our hearts. Both, again, from a physical and an emotional standpoint.
One of my very first symptoms of perimenopause, and I had no idea because I thought I was too young for all of that. First, my hair. I noticed my hair changed. And then I noticed I had anxiety about things that didn't make sense. For example, how heavy my dishes are in my cabinet. I never thought about that once in my life, and then all of a sudden I had this anxiety about things being too heavy, or it just made no sense. But why am I anxious about these things? And being an empty nester, so much more anxiety for my kids out of the house, and that was new, and it's uncomfortable, and exactly, you lose the capacity. It just changed. That was my first just anxiety symptom that I ever had, and it was just because my hormones were dropping.
When estrogen is a really good protector. So it helps us protect our body, but it also helps protect our mind. Of course, you want a good balance because we talked a little bit about too high of estrogen, so that's not good. But too low of estrogen can also cause some dysfunction in our body. So estrogen overall can help protect against cortisol. When that estrogen gets too low, it just can't, our bodies don't respond to cortisol the way that it was supposed to or designed to be. So that is also another physiological reaction in menopause, why women feel like they have so much more stress. It's because they physically do.
Yeah, absolutely.
Well, so that goes into our next myth that weight gain is just about eating too much or not exercising enough and you have a slow metabolism. So does menopause, perimenopause affect our weight gain?
Yeah, I love this. But I had one of my patients come in and she was like, I do not eat sweets anymore. I do not eat simple carbs. I don't do any of that anymore. And I went and I saw my primary care and they were like, wow, you must have really increased the sweets. Like your weight is fluctuating, your sugars are completely off. And she's like, I've never been eating healthier in my life. And that is menopause. The unfortunate side effect is that with the shifts of the estrogen, the progesterone, even your thyroid, that just changes the way that you process, metabolize all of the food and can actually change you physically too.
Well, and even how our body, where you were talking about insulin regulating cortisol, it also regulates blood sugar and insulin. So all of a sudden I was insulin resistant and I never had trouble with my blood sugar in my life. And all of a sudden I'm having blood sugar drops. And so I wore a CGM for a while, a continuous glucose monitor, to just kind of learn about what was happening in my body because this was new to me. And I was having drops because I was having spikes. Well, why am I having blood sugar spikes? I eat a clean diet, and why is that happening? Well, it's the drop in my estrogen was causing my body not to be able to manage blood sugar as well. So I did have to make really big changes in my diet that I didn't have to before. And even timing, fiber first, and then protein, and then if I had something, carbohydrate as far as a starchy carb, very last, and fruit last, so then I didn't have those big blood sugar spikes. So we do need to make changes in preparation, even as we're starting to step into perimenopause. Start making those changes in advance so that you're on top of it, so that you don't all of a sudden have this weight gain out of nowhere or these blood sugar drops out of nowhere. Having more protein, and we've talked about diet so many times, just about a healthy diet, but adding protein in every meal, expecting blood sugar to be an issue as you go into perimenopause, it's a good place to start. Lots of vegetables and definitely lowering your sugar and those starchy carbs. If you're going to eat them last. Yeah. Do you have insight on that?
No, I was just going to say I love that you mentioned that because so often for me, there are even clients that come in here that aren't necessarily people that I work specifically with, is hearing women say, well, I'm doing everything right, calories in, calories out, I'm doing the workout, I'm eating healthier than ever. And to your point, just saying it's actually a shift in what you're going to eat, and some things that may have worked are not going to work.
Yes.
But there's hope in once you change that diet, once you find something that works for your body, you can actually work with your body instead of a lot of the messaging that we get is, well, you're eating too much, exercise more, which can feel very defeating and not helpful at all.
Yes. Okay, myth number 3. Mood swings and depression are just part of the deal. Tough it out.
I think you should tackle this one first.
Yeah. I was just going to share that with women. So with perimenopause, about 40% of women are more likely to experience depression in this state alone, right? Carrie mentioned how there's more anxiety, cortisol is running through your body. Depression can often set in, and something that I hear with women is another myth of, well, my mom dealt with it, what's wrong with me? Why can't I just tough it out? What's wrong? Why can't I fix this? And women start to shame themselves or really doubt themselves. And so just realizing that often when we're minimizing women's experience, right, I don't hear a lot of women talk about this. Just in society, but also I think there's a good thing about how society is starting to talk more about menopause. But even with women, a lot of women I'll see with post-menopause, and I'll ask, I'll take a deep history of their hormones and menopause and how it impacted them, and a lot of them will say, well, I just never talked to anyone about it. I just kind of thought this was normal. My mom did it, and we just suffered alone and couldn't rely on my partner because he wasn't able to understand. and just realizing how that can actually lead to more depression, right? Women need a lot of support. We talk about cortisol and estrogen, and when estrogen drops, cortisol gets high, we actually need more oxytocin. We need more bonding. That's the bonding hormone that allows your body to receive and feel soothed. And it's tricky because, to Carrie's point, right, this is when a lot of women will go into empty nesting, social circles get smaller, you're going through a lot of different shifts in energy and anxiety. Sometimes it's harder, or it's easier to isolate. It's harder to show up and just be your happy self or your normal self because nothing feels normal right now. And so depression can set in, but that's not part of the deal. Right? When we actually invite support in, when we invite even with our partners, I was kind of looking up some statistics before this and realizing that about 68% of women will actually initiate a divorce in this season because it's so tumultuous. You're changing, and now the relationship is changing. I work with men as well too, and hearing from their perspective of, we had this relationship, we had these rules, and then the rules changed. And I don't know how to fit into this either. And so sometimes they'll react, and it's hard to actually come together. And when women need even more support, there's disconnection. And so realizing this is not a normal part, but this is an invitation in a way to actually create much more support for women. We need support. Estrogen is what helps us mimic some of that nurturing and even recognize empathetically what someone else needs, right? That's what we need, why we need estrogen when we're having babies, because we want to be very nurturing and supportive of their needs. And then as it's dropping, realizing sometimes our personality will change too. We might not be as caring. We might be way more upfront. We might have stronger boundaries. We might even have some more rage and anger of, no, this is not okay with me. And recognizing something that I often do with clients is realizing this is actually a huge gift, right? Your role in the past was being a mom, being a friend, being the support. And now this is kind of like God's gift saying, let's shift into who are you actually? What is your purpose outside of nurturing and taking care of others? What are the desires in your heart? If we could actually bring them to the surface and remove the guilt and the shame about having them, something really beautiful can happen. A lot of women will go through, a midlife crisis and actually find themselves and discover who they are and recognize their identity, their purpose, their calling, and it can be a really, really beautiful season. But if our mindset is in a way where we're not getting support and allowing people to walk us through that journey, we can get really stuck really fast.
I think not understanding where these emotions are coming from, and when you do have these changes and drops in hormones, and it ebbs and flows, right? So we'll have high estrogen and then low estrogen and then high and then low, and it's you go through a lot of fluctuations in how you feel physically. Your body changes so much without estrogen too. And I think women are dealing with the emotions behind, my skin is different. I look different. You're aging and kind of comes out of nowhere, you feel like. And that affects how you relate to your partner too, right? And, and if they're noticing a change, sometimes that can affect the relationship in that way. So I think men understanding these changes that are happening to women that they didn't really have a lot of control over. We didn't expect to all of a sudden be insulin resistant. I've been doing all of these things that I've been doing, and you can have that belly fat and weight gain in areas, in the hips and things like that. That is, if you don't plan ahead, that happens kind of without your permission. And so a lot of emotions I think are mixed up in there. And I pulled this up because I always forget the name of the author, Dr. Lisa Mosconi, wrote a book called The Menopause Brain, which I really love her so much, talking about the actual changes that happen to the brain during menopause when estrogen is lowering. The hypothalamus actually can shrink, and our brain, the neurons that we used for, getting our kids ready for school and all the things that we can handle when we're off, we're making lunches and we're getting them ready and we're off, and then we go to work happily and everything's great. All of a sudden that shifts when our hormones drop. So we don't have the capacity. We get more irritable, and there's actual data to show the brain really changes physically from what it was. New neurons are being made, and that process of losing neurons and making new ones feels like, why can't I remember anything? Or why did I, even more so, why did I walk into this room? Or I can't remember the name, or you forget things, and it's a scary, scary place. I know. For me, thinking, what's wrong with my brain? You know, something's happening to me and it's scary. Well, it's in that transition and it's expected and it's normal and it's okay. And I just want people to be aware that there are actual changes happening to your brain, and have grace with yourself, and have grace with your wives and your moms, because there is actual changes. So I definitely recommend looking at that book. And so, yeah, it's a scary time where we do need support and love for ourselves at the same time.
What was the name of that book again?
The Menopause Brain.
It's good. Very good.
Yeah.
I'm going to join.
Yeah.
I want to join because it's such a great topic.
We were on the myth. This is the myth. Mood swings and depression are just part of the deal.
Oh, you can't do anything about it?
Yeah.
Yeah.
Yeah. What's your insight?
Well, yeah. I mean, as someone going through it too, like it's definitely there. And you were already touching on it, the hypothalamus. And we've already had a podcast on the amygdala and how that regulates emotions. And when you don't have that estrogen helping modulate it, it just gets harder to control.
Yeah.
So then your emotions are just like,
Yeah.
so, but if you know ahead of time, like that helps you understand what's going on, so you can do things about it, like maybe upping your regular prayer, meditation, increasing your exercise, you know, when it's appropriate. Like those kind of things can help you manage it a little bit better. So, yeah.
Well, what do you think about exercise during this time of your life? I feel like going hard after, you know, lots of cardio and lots of strenuous exercise isn't always perfect for the perimenopausal woman, where walks and strength training and a little bit calmer exercise. What do you think about that?
My take on that is you have to learn your body and what you can manage and handle. I do think because those hormones are lower, especially like testosterone, as that starts to drop, if you're not supplementing, like when you exercise, you deplete it even more. And so if you notice like, man, I work out and an hour later I have to take a nap, then you're probably pushing it too hard. You know, those HIIT classes might be too much. Also, when those hormones are lowering, your collagen needs those hormones to be healthy too. So you're not repairing as well. So then you get more achy and more joint pain. And so just kind of being aware that could be why you're not feeling great. Can help you modify what you're doing. And so maybe you do less HIIT classes and you do more cardio. Maybe you go down to 1 day a week of HIIT classes and you do yoga instead, you know, just kind of trying to find that sweet spot. But gaining more muscle mass definitely helps with that lipid and blood sugar management that you were talking about. And then, yeah, the more muscle you have, the better, the less pain you have. And, you know, as long as you're not, again, ripping and tearing and you're not repairing in between. But yeah.
Yeah.
What are you guys' thoughts?
Yeah, I would concur.
Yeah.
I think that overall there should be a little bit of a shift on how you work out, but just saying no to cardio isn't necessarily the solution either.
Right.
Like some women really just love running and that's where they find their peace. And so if that's the case, okay, how do we make that work in your lifestyle? How do we add strength training to prevent injuries, making sure that you're recovering well? Maybe you're not doing the marathon and maybe just a half marathon for a couple of years until your body starts stabilizing and shifting it, but working it within your life. I think you really hit the nail on the head with that one.
Yeah, and same thing with like the thyroid too. Your thyroid starts to diminish because you need those estrogens to have a healthy proliferative thyroid too. And when you exercise, if you're running marathons, you're just depleting it. You're wiping it out for the rest of your day. So like I kind of cap it at 3 miles, you know, a couple times a week. That's what works for me. But I've had the same thing. I've had women come in and be like, I just miss running. Like you don't have to stop running. Like if you love it and it's a great mental release for you. But I would agree, like maybe, I mean, I would say marathons aren't good for anyone at any point. You're doing that for a different reason, for a mental goal or connection, but really isn't great for the body in my opinion. So, but especially now.
Yep.
So
menopause only affects older women. I think we can both say definitely not.
Yeah.
Yes. What's the reality of, and it's not just menopause, it's perimenopause too, where we really start feeling all of these things. So, I mean, it's definitely not women that are in their 60s that are starting to deal with this.
No.
Right?
I would say that's probably the biggest myth that I run into is that people do not know how soon it can start, those symptoms. I mean, you can be like 10 years out before you hit menopause and you're having those symptoms. And if you're not aware of that, you're like, what is going on? And so just busting that myth is a big one.
I know
go
something
ahead.
that I've heard, and this is just a question because I don't have the knowledge for it, but something that I've been hearing is the earlier you start your menses, the earlier you're going to get menopause. Is that correlated in any way?
Not that I know of. In fact, I would think it might be the opposite, because you're gonna, essentially, if you're starting menopause early, or not menopause, menses early, that can be a sign that your hormones are elevated more than they should be because of environmental toxin exposures or lifestyle.
Hormones.
And so that, to me, would say that you might even prolong it longer. But which is, there's definitely benefits and negatives with that. I mean, overall, the research is if you have an extended time period, late menses, early onset menses, late perimenopause, that increases your risk of things like breast cancer and things like that because of that prolonged exposure. But also hormones in general are also good, so it's kind of holding it in both hands. So, but looking maybe at the underlying health stuff going on. But yeah, I haven't heard that.
Okay.
No.
So menopause ends your femininity, your sexuality, and desirability.
What's
Myth.
this one?
I think it can really, I think it changes the way that you view yourself. And as long as you go about it, working on how you want to be in that next phase, you can experience more femininity and more desirability. It kind of helps get rid of the superficial components that often our society really likes, like no wrinkles. But in reality, once you feel comfortable with your body, that's the most desirable thing, confidence. And so you can really then find your true confidence.
Well, and there is a physiological drop in libido because of hormones. And also, I can tell you, I have so many women say to me in my office, I don't have sex with my husband because I have vaginal dryness and it hurts. And, you don't have to suffer with that. And it can start really early, especially if you had an early hysterectomy and hormones kind of just stop abruptly and you don't support that, then that can happen really early. So it's definitely not something that happens in your 60s. It can happen really early, and definitely there's something to do about that, and you shouldn't be suffering that way. And I try to talk to the husband and the wife together and just to say, understand this is happening because of low hormones. Something can be done about it, and this should be an important part of your marriage that doesn't end just because of perimenopause, but it does affect your libido because it's painful, right? So, and then also then obviously how you feel about yourself is affected because of that, which also affects your libido, I think. And the changes in estrogen to just how it kind of plumps the skin, when that starts to lower, then the skin changes,
Vaginal atrophy.
yeah, so that's why also even the vaginal tissue can atrophy, and so it's painful, but it's painful for the man also. So it's, I think making sure that you have clean products that are lubrication if you need that, but also I think that having vaginal estrogen is helpful if you've talked to your doctor about it and if they support that. Every case is different, but I do find that is really helpful. We do have a service here that we offer that can really help also. Vaginal rejuvenation we do offer here. We don't talk a lot about it on any of our social media, but we do have that here, and that does help plump the skin and lubricate, and can be a really great answer for women that are suffering with that.
Yep. Do you have anything, Ellie, to talk about the image? Like, do you help women walk through that change in their body types and getting comfortable in that stage?
Yeah, I love that you bring that up because shame is something that comes up quite a bit. Because your identity is changing so much, right? Your body is changing, your mind is changing, your relationships are changing, and it can make women feel like they're going crazy in one way because it's happening so fast. And so for women, something that I often talk to women about, I love what you said with your idea of femininity, right? Femininity is not just when you're reproductive, but when that ends, what is your identity? What is your purpose? And so even with our nervous system, kind of a really simple way to think about it is when we have compassion It actually allows us to get to a point where we can engage with ourselves authentically and connect to others as well as to God when we have any kind of shame about our body, about our experience. Often I'll see women try to lean in and push and try harder and put even more responsibility on themselves, right? What can I do with exercise, with eating, with my mental health? And it can either isolate them or it can actually, that's a shame spiral. Shame tells us do something about the pain or the tension that you're feeling. And so for women, my encouragement, and this is obviously, easier said than done, is actually leaning into surrendering into the process, right? There's something that we do with nervous system care of naming the emotion to tame it. When we actually lean into, this is really hard, this is uncomfortable, I'm having rage right now, actually connecting to ourselves in that experience instead of trying to regulate out of it or fix it or distract ourselves. It opens up our nervous system to now be able to either resource, so it's either things internally or externally that can soothe us, or often what we need of support and what we call co-regulation. So instead of self-soothing, which a lot of women have been programmed to do, right? Because we've also been taught to soothe our husbands, soothe our children, soothe our friends. We're the strong one that people rely on. This is shifting really fast because of our hormones. And so learning to surrender and lean into that process instead of push against it and do more, recognizing that's actually shame, and pushing through that. Not necessarily pushing through, but just leaning in, surrendering, inviting support in. It's going to look different. And that's by design, and again, it can actually be a big gift, because now you have resources, now you have access to, in your later stage of life, be able to navigate the highs and lows that your nervous system needs.
Great, love that.
I'd like to bring up just a stereotype and get you guys' opinion on it. Like, I hear this a lot too from lots of people, I guess, when it comes up is, will men age better than women in their appearance? And I personally have decided to not believe that. I think that's a stereotype that's put on from society, and when I look out in the world, I don't see that to be true, but I feel like that is a negative that's put on women in our society, that okay, you're not, like you mentioned, like not as desirable now because you're older. And I just think that doesn't have to be true. Like, I think we need to just change that shift and or shift that into a different mindset. And then I would think that would produce different outcomes. Like, we don't have to follow that negative stereotype or thought, I guess.
Yeah, that's good.
Yeah.
Yeah, thank you for saying that. I appreciate that. It's good thought.
Yeah.
Testosterone makes you like a man. As far as testosterone replacement, if I do testosterone replacement, will my voice get lower? Will my jaw get larger? Is that going to happen when I do testosterone replacement? No.
Go ahead. So women need testosterone.
Yes.
It is very important, especially when it comes to muscle mass, bone mass, and then also our libido. But also it gives us kind of a little bit of a fire underneath us and gives us energy and gumption. And so with menopause, you decrease all of your hormones, including testosterone. So testosterone can really give you that je ne sais quoi back, or that zest of life in a really good and healthy way. And now it can also make you angry and really anxious. So if you have those symptoms after you do take testosterone, titrate back down, talk to your provider.
Yep. We test. That's why we test.
Yes, that's why we test every 3 months, just to make sure that those are okay. So if you have those symptoms, let us know. But overall, testosterone can really boost you.
Yeah. I can say personally, I do replace testosterone, and I just started that recently. So I do replacement for all. Estrogen, testosterone, and progesterone, which has been life-changing for me. I can sleep at night, and I don't wake up 15 times hot. And I didn't replace testosterone right away, and this is how I was feeling, really tired. Estrogen was part of that, but feeling like my muscles hurt. They felt achy. I don't even burny all the time, and so it would take me a while to warm up my muscles before I could start my strength training program. Once I started testosterone replacement, and I have a low level right now, it's cream, and I don't have that pain in my muscles, and I have so much more energy. So it's been life-changing for me, and it's not going to put me to that point. Sure, too much testosterone could be too much, right? And so I know what to watch for. Do I feel rageful, or is my hair falling out? Am I getting acne? Things like that. But for me, it's been really helpful. So I don't want women to be afraid of that.
Yeah. Yep.
Something that I've heard recently, and this was actually in regards to men with testosterone, being worried about going on testosterone replacement, was testosterone actually just makes you more authentic of who you are. And so even for men, and you guys can both speak to this if this is true or not, but how with men, obviously if you do too much and overexpose, that's going to create problems. But often with men, it's not like this person that's usually more chill and calm and able to go with the flow. Once he's on testosterone, is going to become this, macho, outspoken, aggressive, essentially, person. And so just even recognizing that testosterone, to your point, brings up a little bit more of an energy and a little bit of a fire, not necessarily equals aggression.
I think it depends on the dose and that you're being monitored correctly. Like, yes, like you said, it can be, you can get too much. And I think then that's when some of that rage and issues start to come. But if we're talking about getting in the therapeutic range, meaning you're not currently in a normal range because it's dropped. It's just bringing you back into that normal range. So you can keep getting the benefits from it. But it's if you get above those ranges, then that's not going to be so good probably.
And like you said, that's why we test.
Yeah.
Yes. Your brain fog means you're getting dementia or cognitive decline. That's a myth.
Yeah, I'll comment on this because I did read some research articles on that, is that it's very common for women in this stage, in perimenopause, menopause, to feel like that. But when they've tested it, they've actually looked at their cognitive ability, they're maintaining well. It's more in simple things like remembering names or not feeling confident that you are completing the task as you used to. But usually the cognition, it's not like going into mild dementia or Alzheimer's. Yes, that can happen, but in general, what women typically feel, they're still maintaining their cognitive abilities. It's just those little issues that start to pop up. So it's a little bit of a difference, I would say.
Yeah, and in that, like I talked about earlier, in that change over from the neurons changing, and the hormones dropping so quick, we just get that brain fog, and it doesn't mean that you're getting dementia. So, yeah.
And change in sleep.
Yes, exactly.
Yeah,
Good
you
point.
don't get that deep sleep. You're holding that lymphatic system, which is your brain's lymphatic system, doesn't drain. So you have these toxins build up. But that does lead, that's why we are such a proponent of like recognizing these symptoms early and getting on it, because that can eventually lead to something less, more detrimental. But those early signs you don't have to like get so worried and scared. It can be something that can be helped. Yeah.
Once your hormones decline, there's nothing you can do about it.
False.
Yes.
It used to be studies, when I first started looking at hormones, they used to say 10 years, you could only take bioidentical or HRT for 10 years, you had to get off it. You couldn't start it after 60, I think it was, because of a worry of causing a clot. So a clot that had formed would dislodge and cause a stroke. Research now is saying that is not true. You can start it later, and I'm not someone who prescribes bioidentical. That's for our clinic, Rochelle, our PA, but she can talk to you more about it. But the safety of it is saying now apparently that we can start it later in life. So once it's dropped, it can be started again, even later. So even 60s, 70s, if progesterone is needed for sleep, my understanding is it's something that could be talked about with a provider.
I think it's kind of hard too, because nutritionally wise, naturally wise, there is a limitation on how we can build up those hormones. So once you enter menopause and your hormones do drop, no amount of supplements will ever get it back to where they once were. And that's why we're such a huge component of bioidentical hormone replacement therapy, because it's kind of the only solution to get you back to where you were.
Yeah. As functional medicine providers, I get that question like, well, how do I get it back now without doing this? Well, it's not. Yes, we can do herbals that can stimulate the estrogen receptors. But it's going to be at a fraction. I've had people feel better. Like I would say, I always explain it with herbal supplement and diet, exercise, they feel better, but it's not the same level. And but everyone's different too. Like some people go through menopause like no problem. They don't notice anything. a lot of people do have problems. So it can, there's some things, but yeah, like you said, nothing's going to turn the ovaries back on to produce those hormones. They're done.
Right. What I wanted to say too, I think there's fear around the blood clots with hormone replacement. And the studies show there can be an increase with oral estrogen, but not with a topical estrogen. I personally have a blood clotting disorder, and that was a question for me. Can I do that? And I do, and I can, and I'm fine. And I'm not just being a guinea pig. I mean, I read a lot of studies, and I did talk to my nurse practitioner, in our PA. Will say the same thing. It's safe, and there's been a lot of myths around hormone replacement that have been debunked in a lot of areas, and that's one of them. So I don't want women to be fearful of that. Obviously, talk to your doctor and make sure that you're getting the best advice, but that's not always the case.
Yeah. And the importance of having someone who knows what they're doing because of what you just said. What is the appropriate application of it? Yeah.
Yes, and if you're doing hormone replacement and you have a uterus, you need to do estrogen and progesterone together and never just estrogen. But your provider that you talk to should know all of that information.
I do see that a lot, though, still. I feel like it's coming less and less, but I have seen women just on estrogen from others outside clinics. Yeah. So.
What's really nice about Rochelle, who is our PA that does this, is that she really takes the whole body into consideration, and she takes you as an individual into your approach. So she does creams, she does vaginal suppositories and pills, and she creates the perfect concoction for you. Yeah. And so the only thing she doesn't do is pellets, because that's something that you put underneath your skin and you leave it for a couple of weeks to a couple of months, depending on the dose. She doesn't like that because she can't control it. So once it's in, it's in. So she always loves to be able to control how much you're getting, how you respond to that, and then change it based on that. So that's something I really appreciate about her, is that she does her research, and then she listens to you too.
Yep.
Yeah. So that leads into our last myth. We've touched on it, I think, already, but hormone replacement therapy is unsafe for all women, that you shouldn't replace your hormones. Obviously, I think we've made that clear that that's not true. And estrogen is cancer protective, stroke protective, heart attack protective. And so somehow it's gotten such a bad rap.
Well, because the early studies were done with horse hormones. And so that's what they were tested originally in like the early 2090s. And yeah, those aren't good for us because they're horse hormones. And so the big scare came out, like estrogen causes all of these things, but in reality, horse estrogen causes those things, not bioidentical estrogen.
Well, and if I remember right, that test was also done on women that were already 10 years past, into menopause, that had no hormone replacement at all, and they weren't doing progesterone together with estrogen. So it was a very flawed study.
It's a very flawed study.
And the doctors have been thinking that that's the rule now. And luckily in functional medicine, we're breaking through that. And I appreciate
25 years later, yeah.
I know, sadly. Yeah, so I appreciate our PA Rochelle really educating our clients, our patients on that, and, doing what's best for them. Yeah. Menopause is both a physiological and psychological transition. And do you have anything to say on that? I think we kind of...
Yeah, no, it is. It affects, because if you've heard me talk before, estrogen and progesterone, testosterone, they affect so much of our body. And so it's even more than that, I would say. It's gut health, it's other hormones, thyroid health, it's your vestibular system health. People in this stage start to have vertigo issues more commonly. And so brain health, we talked about emotional health, bone health,
bone
muscle
loss.
health, it just touches on everything. So yes, like mental and mental, emotional, physical, all the things.
Yeah. Okay, well that's the end of the myths that we had. So thank you for joining.
That concludes today's episode of Beyond the Superficial. Thank you for joining us, and stay tuned for more episodes. For more information, please visit our website, www.officialsynapse.com, your partners in healthy living for optimal life. We would love to hear from you on how our podcast might be impacting your life. We also want to hear what interests you. Please leave your feedback on our media page at www.officialsynapse.com. Thanks again for listening, and we'll catch you in the next episode.